We spent a good deal of time last week looking at the recently passed National Health Insurance Bill. It's still got to go to the NCOP and then the President's desk, but trying to understand it from as many angles as possible. And tonight we share another take, this time from the organisation Business Leadership South Africa. The NHI is intended to create universal health coverage for all citizens, regardless of whether they are employed or not, and across all social classes. Busisiwe Mavuso is the CEO of BLSA and joins us now. Good evening to you and welcome. In your view, organised business strongly in favour of universal health coverage, but it needs a workable plan to deliver. You're not buying the promise that this government can deliver it competently. Busi, why?
Iman, good evening and thank you very much. Look, I think you have rightfully said it. Business honestly has every interest in seeing the universal healthcare coverage in South Africa being implemented, because it obviously seeks to address the vast inequalities, and that is critical. But we worry that because of the fact that the NHI as it stands now has been ill-conceived, or rather the way it is conceived, it doesn't really address what it purports to address or what it plans to address. As it stands now, it is going to leave all South Africans worse off in a system in which state provision becomes impossible and private healthcare provision is effectively closed down. I think the system, first of all, plans to impose a single-payer model in which government is the only buyer of healthcare services for its citizens, and that is not going to be efficient. It is going to seriously relegate the private health insurance market to only complementary healthcare that is not covered by the state scheme. But also, when you look at it, you know that a single-payer model, given the shocking state of our public health care, where there has been a deterioration of care quality in most provinces, as was condemned by the outgoing health ombudsman, Malchapur Makgoba, is going to be disastrous. So the government has not even come out with an implementation plan of what this thing is going to look like, not even a funding plan of how we are actually going to make sure that this gets funded. If they say it's going to be funded through the fiscus, then you're going to have a way of somehow growing the tax base. Now, what does that look like in an environment where you've got this deteriorating trading environment and you've got very minimal foreign direct investment coming in, which means the economy is not going to grow at the right levels, and you are therefore going to be seeing, more industries shrinking and more people out of jobs. So it therefore doesn't make sense. It really looks like something that is more of a populist stance versus government really implementing this because it believes that it is going to work. Yeah. This thing in its current state is definitely not going to work.
Busi, we spoke to a number of activists. Of course, there's a dichotomy, and in fact, probably more than that, a plethora of views. Some assenting and some dissenting on the concept of the NHI or the design of the NHI as it's being proposed. But what we did hear was that it would have the effect of putting agency in the hands of regional hospitals or medical institutions. It will be able to tailor-make and customize its medical provision and offering to those communities. It would have the added benefit, a raft of benefits, have the added benefit, of making sure that there's resources for improving the infrastructure and so on, and really creating a new standard of healthcare in South Africa. And it also said, and we heard from the DDG and from the Deputy Minister, that, the specificity around funding and the actual architecture of it is one of the next steps. But you would have wanted them to have had this in place before this bill was even passed.
I mean, you can't even pass a bill like this when you don't know how you're going to fund it. It doesn't make sense. It is really irresponsible, if I can call it that. But I think you see what the NHI model does, Iman. It takes us back to the monopoly model that has already failed so fundamentally in South Africa, in so many areas of the public service. Why would we want to take our entire healthcare system to a monopoly model that has actually failed? Right now, Government is reversing monopolies in electricity, in freight rail, because it is failing. Why would we want to take our healthcare system to a model that has failed in so many areas? But also, given the systemic and endemic corruption and the failure of so many public institutions, never mind the scale of state capture, which is still continuing, by the way, and the mass looting that happens in government, we cannot be blamed for suspecting that this is another version of the state capture project. Why can't we look at a system, Iman, in which all health insurers compete in a marketplace, because through the marketplace, insurers compete to offer the best prices to patients, and those patients can then also choose where to go for healthcare when needed. The blending of public and private cover has been done successfully elsewhere in the world, where the public healthcare system works alongside private service providers. Yeah. So the NHI format proposed is, number one, going to be hugely expensive. As I've said, even the finance minister is clear that the country cannot afford this. It is going to draw resources out of the rest of the government and the services it provides, while increasing the tax burden on all of us. You are going to experience fiscal slippage at the rate at which government is going. But more importantly, the quality of care is going to be seriously compromised, Iman.
Just a quick one, on this idea of there being healthy competition, a flattening of prices, greater access of people, if the private sector is allowed to compete in the way that you're saying, why do you think they've not done this so far? I, for one, who pays, an exorbitant amount of money to keep my kids and my mom on my medical aid, would have welcomed that. But it does seem, as government is saying, and according to the white paper, 16% of the population, having access to the lion's share of those resources, with the dregs or the leftovers going to those in the public health sector.
Iman, you implement a system like this in an environment that is functional, in an environment that works, in an environment where there has been proven implementation successes, in an environment where this thing has already been clearly articulated in terms of how it's going to work and how the delivery model is going to take place. Now, at the moment, in this dysfunctional public system, and you want to actually, say you are not only going to be responsible for a portion of the population, but the entire population, what is that going to look like? What guarantees do we have as a South African service that this is not even going to plunge our healthcare system further? Because they are struggling, to service the current fraction of the public. Now, if you put the entire 65 million of us, onto the public system that is already collapsing and dysfunctional, what does that look like? So there isn't anything that actually signals that government is actually ready to implement this bill, that they've got a plan in terms of how they are going to implement it, and they've got a delivery model that is actually going to be, and I've already spoken about funding. I'm not even going to go there. So what convinces us, therefore, that all of a sudden you implement NHI and they move, from this public health care that is absolutely disastrous and dysfunctional, and they're now going to give us quality healthcare service. Yeah. There is nothing in terms of what they've put on the table so far. And when you look at that bill, it says very little about how they actually plan to roll this out. So as the private sector, we are saying we have worked together well with government, on a whole lot of areas. We are currently working with them on energy, transport and logistics, and crime and corruption. Why can't we add healthcare as a fourth work stream in terms of the business and government collaboration that you have in place? Allow the private sector to actually bring in its resources, bring in its expertise to look at this current bill and look at how we can make it workable. Because at the moment, if the president is going to enact it and sign it off, as dysfunctional and as unworkable as it is, you are plunging the country into further economic rut. You are actually making the environment worse than what it currently is. And I think that is the engagement that we're having with government at the moment, to say, allow the private sector in to tell us, or rather so that we can tell you how we have made the private healthcare system work, and let's see how we can actually take those learnings and interpose them onto the public healthcare system and see what delivery of this thing can look like.
In literally 20 seconds, because that discussion might be moot. It's been passed in the National Assembly. It's going to the NCOP and then the president. Are you going to fight this very quickly? I mean, what's left? What can you do?
We've already reached out to the president to have a conversation with him. And I think we're actually looking at all avenues. There's obviously advocacy. There is the legal avenue that we're looking at. We are going to pull out all stops as business to make sure that government doesn't make yet another irresponsible decision when it comes to this. So I think there is conversations that are currently happening. And we are, also ready to say that we are happy to outlay funding, infrastructure, resources, skills, capability to help government ensure that this thing can be workable, because it is important. Right. We agree with them on that.
Busisiwe Mavuso, thank you very much, the CEO of Business Leadership South Africa. Thank you for talking to us.